Good evening. I'm getting ready to do thorax and lung assessment on this young lady. I'm Bianca, I'll be your nurse. I'm getting ready to do your assessment.
Hi.
So first, I'm going to start by assessing the patient. I'm going to make sure that, you can look forward. I'm going to make sure that her breathing is unlabored and her respirations are even and that she's not using any extra effort to breathe. I'm also going to inspect her color on her face and around her mouth area to make sure there's no purpling, which could be a sign of hypoxia. I'm going to look at her nails, messy your hands, to make sure there's no sign of clubbing, which could be a sign of hypoxia as well, and cyanosis. Next, I'm going to look at her posterior. I'm just going to move your hair to the side to make sure that her scapula is nice and even. I'm also going to look at her trapezoid diameter and her posterior anterior to make sure that that ratio is 1 to 2, and that would ensure that there is no barrel chest, which could be a sign of COPD. So the scapula is nice and aligned. Next, I'm going to palpate. I'm going to be checking for any warmth or redness, any lumps or lesions that may, or any soreness that may be attributed to her breathing hard and making her work harder with her breathing. Redness, which may be attributed to any sign of infection or warmness as well. So she has none of that going on right now. Next, I'm going to check for crepitus, which is like crackling coming through the lungs. It's usually from consolidation and from some congestion, and she has no sign of that as well. Next, I'm going to check for firmitus. Would you mind repeating 99 for me?
99.
Every time I press.
99.
Good.
99. 99. 99. 99.
Good. So I just checked for her firmitus, which is equal. If she had any unequal firmitus, it would be a possible sign of a pneumothorax or something of that sort. Next, I'm going to auscultate her lungs and listen. Here I'm going to be listening for her bronchia, her bronchial fascicular, and her vesicular sounds. So Gabby, I just need you to take some deep breaths in and out every time I touch you with the step, okay? In and out. Big breaths. Good. Another big breath. Big breath. Big breath. Big breath. And here I would just be checking for any, her sounds are nice and clear. However, if she did have any diminished sounds, that would be a possible sign of sometimes hyperinflation in emphysema patients prevents the air from moving through the lungs. Also, if she had any wheezing caused by asthma or a bronchial constriction, I would hear that. And crackling is also a sign of fluid in the lungs. Next, I'm going to check for her resonance by percussion. I'm going to just tap on you, okay? So don't be alarmed. In checking for resonance, I'll be checking for hyperresonance, which is extra air in the lungs. I should hear some type of sound, but once I get to the lower parts of the thorax, it'll be dull because that's where your lobes are. But if I was to hear hyperresonance, that means there's some extra air in the lung. Next, I'm going to check her inflation. I just need you to breathe deep. Good. And back in. Good. And your chest, do it again one more time. Chest expansion is good. Usually it's between, you can breathe in. Inhale. Exhale. Good. Is anywhere between 3 to 5 inches. Also, in using percussion, you can check for the height of your excursion or your diaphragm. You will percuss down, and then you will measure here, and then you will percuss some more. All right, next I'm going to check your anterior, basically doing the same thing that I did on the front end. I'm going to check for your rate. You just breathe normally. I'm going to just time it. Okay, she has a rate of 14, which is normal. Anything between 12 and 20 is what we're looking for. And I'm also looking at her color again, making sure that she has the appropriate color. I'm also going to do plenty of the things that I did before, just palpating to make sure she has no lumps, no lesions, no warmth, no swelling, no soreness around her lung area. I'm also gonna percuss, just like I did before, checking for resonance. And I'm going to auscultate to listen for lung sounds again. Do deep breaths like we did before. Good. Okay, and that concludes our assessment. Thank you.